So there's a lot of excitement right now in the field of kidney cancer about early adoption of immunotherapy with combination regimens that are built on PD-1 blockade. So we've seen last year the approval of PD-1 and CTLA-4 combinations with ipilimumab and nivolumab for patients with intermediate and poor risk kidney cancer. We're seeing a lot of exciting data, including at this meeting, looking at PD-1 plus VEGF combinations, the most recent being Keynote 426, which looked at Axitinib and Pembrolizumab in our patients with kidney cancer. But little was known about single agent PD-1, particularly with Pembrolizumab in kidney cancer in untreated patients. So the Keynote 427 trial was a way of trying to get some data, information on how does single agent therapy perform in untreated patients. And it turns out it performs better than we thought. I mean, we were interested in exploring this, but when we looked at this Keynote 427 study, there were two groups of patients. Cohort A, which we looked at last year, which clear cell kidney cancer. Response rate there was 36%, better than we expected, with very good tolerability. This year, we're looking at the non-clear cell group of patients which these are patients with few treatment options. There are no FDA-approved regimens just for those patients. They often get referred for clinical trials, and in immunotherapy, they're often excluded from those trials. So we did a trial here just for those patients. Looking at 165 people, response rate was 25%. Once again, better than we expected. Most of the patients had papillary kidney cancer, where the response rate was 25%. We enrolled some patients with chromophobe cancer, where the response rate was less. Unclassified kidney cancer response rate was higher, but in general, a well-tolerated regimen. And then we looked at potential predictive markers of benefit in this group. And if you had PD-L1 expression on your tumor, which was over 2/3 of the patients, those patients had 3 times more of a chance of response than those that were PD-L1 negative. So the difference between a 10% response rate in PD-L1 negative and a 30% response rate in PD-L1 positive. So that sort of suggests that maybe we can do better at selecting the patients with non-clear cell kidney cancer. But this looks like as a potentially promising treatment that can be built on in the future for these patients who have so few options.